Hello, beautiful black people. Hope that all is well in your world. And this day is a very, very enjoyable day for you and all of your wonderful, wonderful loved ones. My beautiful, intelligent black brothers and sisters. If you are ever asked, why is it that so many black folks are sick, have chronic conditions, have chronic illnesses such as heart disease, high blood pressure, diabetes, asthma, etc., etc. Well, this content may help you answer that question. Immediately after the Civil War, the racist white leaders of those former slave states in the South deliberately held health care from the freed black Americans. They were apportioning medicine more according to the logic of Jim Crow than the logic of Hippocrates. These racist white folks built hospitals in the South and across this country. They built the hospitals far away from black communities. And then when black folks couldn't make it to the hospital, black folks was segregated into separate wings in the hospital. And black students was blocked from medical schools. In the 20th century, the white folks, racist white folks, right here on this plantation called America, helped construct an American system of private employer-based insurance. Intentionally, you may ask, why is our insurance employer-based? Because back then, when they constructed that dumb system, that dumb idea of tying insurance, health insurance, to the employer, they were thinking that only white folks would be employed. Therefore, white folks would have access to health care, health insurance, and black folks would remain unemployed. Therefore, black folks would not have access to health care. And that system, that intentionally racist system, has kept many black folks from receiving adequate medical treatment. Hence is why black folks suffer a disproportionate amount of chronic illnesses like diabetes, asthma, heart disease, upper respiratory problems, etc., etc. These racist white folks back then fought every attempt to improve black folks' access to health care. And the Republicans are still doing it today. They are fighting tooth and nail to prevent a national health care program, because that is their way of preventing large numbers of black folks from having access to health care. It's still happening today. The creation of Medicare and Medicaid in the 1960s helped, but there were still millions of black folks without health care until the Affordable Care Act / Obamacare in 2010. And it finally gave black folks that never had health care before access to medical treatment. But by that time, millions of black folks and black children already had developed chronic conditions because of not having access to health care. My beautiful, intelligent black brothers and sisters. A number of those former slave states also have among the lowest investment in public health, like Mississippi, Alabama, Louisiana, Arkansas. Those former slave states have the lowest quality of medical care. Those former slave states have the highest proportion of black citizens and the greatest racial divide in health outcomes. As the COVID-19 pandemic rolls on, black folks were among the quickest as the COVID-19 pandemic rolls on. Those former slave states were the first ones, the quickest to lift social distancing restrictions and re-expose black folks, their citizens, to the COVID-19 virus. The damage of these decisions made by white folks, racist white folks, were unduly forced upon poor folks and black folks. For every 1,250 deaths from COVID-19, one of those people are black. Black folks are dying disproportionately from the COVID-19 disease. It is a rate, black people are dying at a rate that is twice that of white folks. Black folks are dying from COVID-19 at a rate that is twice that of white folks. These numbers are tragic and wholly expected given the mountain of medical disadvantages that black folks have faced since the inception of this plantation called America. Compared with white folks, black folks on the average die 3 years younger. 3 times as many black mothers die during pregnancy because they do not have access to health care. Black folks have higher rates of chronic illnesses that predispose them to fatal cases of COVID-19. When black folks go to hospitals, they are less likely to be treated because of the racist white folks working at those hospitals, controlling those hospitals. The care that black folks do receive tend to be lesser care than what is given to white folks at those hospitals. You must be aware of these biases against black folks. Black folks are hesitant to seek aid for COVID-19 symptoms and then show up at hospitals sicker, in critical condition. Black folks will tell you, some black folks will tell you, I do not want to go to the hospital because they are not going to treat me well. Lots of black folks still feel that way in August of 2020. Black folks do not get a quality medical treatment from white folks, from white doctors, my beautiful, intelligent black brothers and sisters. I can attest to that in my own personal experiences with white doctors and the lack of treatment that they will give black folks. Not only the doctors, it's the white racist nurses also. When black folks see a black doctor in a hospital, some of these black folks are relieved and feel much safer because they are being treated by someone that look like them. White folks will allow black folks to die in hospitals. Racism is a mental illness, but racism is a gun to the head of all black folks right here on this plantation called America. That's all I have on this one.